Hi,
How are
I'm
you?
Dr. Philip Schoenfeld from Renew, and we are here with Marianne, who is a patient of mine for quite some time. And Marianne has had injections with us before and is interested in having what today?
I'd like to get some filler around my nose and a little bit of
We've injected Marianne before, and we've used Restylane for that, and it's been very successful for her. A little bit about Restylane: it's a hyaluronic acid, which is a natural product that occurs in the body. The nasolabial folds will last approximately 9 months, the lips probably around 6 or so, and so we re-inject her a couple of times a year probably. It seems to last longer and longer though as we inject you. Yeah. Some of the potential side effects of injections are pain, and we'll talk about how we deal with that. Potentially bruising, and we'll tell you how we deal with that as well. As far as pain goes, there's a lot of ways to numb up the face. I used to use a great deal of blocks, which would be local. What we're going to do is we're going to clean Marianne off with a little alcohol. I already know the areas that we're going to inject, and then we're going to inject her nasolabial folds, and then we're going to inject her lips as well. And we're just going to add a little fullness because she still has, I think, a little bit of product there, but we want to define the lip line a little better and make it a little more voluptuous, you know, especially in the upper lip, maybe the Cupid's bow area, and slightly in the lower lip. So why don't I get some alcohol and clean you off? Okay. So what we're going to do is we're going to put a little ice on Marianne in the nasolabial fold area first. When the local goes in along with the filler, some of the local will actually get into the upper lip, so it'll make it a little more comfortable there, because I find, and the patients will also tell you, that the lip is a lot more sensitive than the cheeks or the nasolabial folds are. So we're going to be careful around that area. So I'm going to have Marianne hold that, and we're going to get out. You can edit that, actually. You can pause it. Okay. So what we're going to do is we're going to put a little ice on Marianne in the nasolabial fold area first. When the local goes in along with the filler, some of the local will actually get into the upper lip, so it'll make it a little more comfortable there, because I find, and the patients will also tell you, that the lip is a lot more sensitive than the cheeks or the nasolabial folds are. So we're going to be careful around that area. So I'm going to have Marianne hold that, and we're going to get out. You can edit that, actually. You can pause it for Marianne. And,
say that again. Mom.
We're going to use for Marianne. And,
say that again. Mom.
We're going to use a split one tube for both sides, since she still has a little bit of product left from her last injection. So we're going to be really conservative, just to fill in the upper part of the nasolabial folds where some of the deeper wrinkles will be. And it's just a slow, steady push of the product. And I do it in a combination of ways. I do it sometimes pushing the product forward as I go in, and sometimes pulling out, something called retrograde. And it's just slow. It's not supposed to be done with any real speed. You just keep an eye on it so that you don't get any lumps, and it's nice and smooth. And you keep an eye on how much you have left, because that's important too, because you're trying to split it equally for her. Some people require 1 tube per side, some people require 2. Good. So you want to make sure that there's no bumps, so you push down a little bit. Open your mouth for a second. And I'll go in there later and make sure it's really smooth. And then we'll go do the other side. Why don't you put ice on the other side, okay? Stop that. You just shut your mouth. Up in the area here, I do it in a fan shape pattern, because it's not a straight line. In fact, when I inject here, I do it in multiple layers, because it's really not just one small groove. It's a groove that actually has dimensions to it. So you have to sort of fill in all those dimensions. So now I'm going to ask Marianne to put that on her lips, and we're going to start with the upper right, so I'm going to have her put it there first. A little bit. Open up your mouth for a while. Good. Just below the lip line, where the red and white line are. And I do this anterograde. In other words, I inject in front of the needle. I find that that makes for a smoother lip and a more comfortable experience for the patient. Now I'm going to have Marianne put some ice on the other side.
Okay.
Open your mouth for a minute. For the lip, I always try not to go too deep because there are large vessels in the lip. And if you hit those, you're going to wind up getting into trouble. And it's more uncomfortable going too deep. And slow is the way to go on the lip. That's really important. If you go too fast, it's very uncomfortable. That looks really nice. And I'm going to do the lower here now. It's already on this side. I'm going to be pretty conservative on how much I put in, because I don't want an overly done lip. I'm going to put a little bit in here, and then I'm going to let that lidocaine set up a little bit for the lower lip here before I start injecting further along. And as you go, you want to make sure that there's no lumps, that it's smooth. It's not like a ribbon. You want to get a little bit onto the red lip here, and you want to get a little bit right in the line to define it. You don't want to put too much here unless you're trying to define Cupid's bow, because otherwise it looks ducky. And nobody likes that. Marianne's a really good sport because this area is tender. She's doing great though. So I'm going to have you put some ice on that other corner there. You can actually move the product around with your fingers, and I do spend time doing that. So what I'm going to do is I'm going to get a little bit of arnica cream on my hands. And what I'm going to do with that is I'm going to smooth out her face and her lips a little bit, and also help with some bruising. Open. Good. And just finger massage that area gently. And that just ensures that the product is distributed equally. Open your mouth a little bit. And then I'm going to feel in here. There's absolutely no lumps. Open again. And that actually feels really good. So I'm going to have Marianne put some ice back on her lips just to keep the bruising down, but I don't see any right now. All right, good? All right, Marianne, we're all good?
Good.
How do you feel?
I feel great, thank
Great.
you.
Why don't you take a look? How do you like it?
It looks good.
Good.
Yep.
I'm glad. I think it looks really appropriate. You may experience a tiny bit of swelling over the next 24 hours. That will
Okay.
go down probably in the next 48 hours.
Okay.
But I think everything looks terrific. You can apply makeup right away. No exercise today.
Okay.
And you give me a call if there's any questions.
Thank you so much.
Absolutely. Thank you.
Good.
Local anesthesia in the gingival sulcus and in the buccal sulcus. But that didn't seem to add too much to the comfort of the procedure. And so the products that we use now contain a lidocaine within the product itself. And so the first injection stings a little bit. And what we do is we try to decrease that sting using just topical ice. And then once the first injection is in, it's actually quite comfortable. And the patients tolerate it quite well.